Unfortunately, we don't know what tomorrow's going to bring. And I have seen it happen where our students feel that they're healthy, and then unfortunately they have an accident.
Hello and welcome to Me Green Money, the UNT Student Money Management Center podcast that covers everything you need to know to be financially successful in college and beyond. Today on the show, we have Stephanie Wilson from the UNT Health and Wellness Center here to help us unpack healthcare costs and health insurance. This conversation will cover what students need to do if they want to be covered through UNT's insurance, what kind of costs they might expect from an out-of-pocket office visit, and things to pay attention to if you're looking to get insurance on your own. Hope you enjoy. Could you introduce yourself and tell me a little bit about yourself?
My name is Stephanie Wilson. I work in the Student Health and Wellness Center Billing Department. I do all the filing for the student insurance charges. I also obviously help with the checkouts and other things, duties that are in the billing department. But my main priority is the student insurance.
Awesome. So why is it important for students to have health insurance, especially if they're young and healthy and may not go to a doctor that much?
Excellent question, and it does come up. But medical insurance is for all ages. Unfortunately, we don't know what tomorrow's going to bring. And I have seen it happen where our students feel that they're healthy, and then unfortunately they have an accident. Accidents could lead you to where you have to get x-rays, surgeries, even hospital stays. When that happens, we're talking it could run into thousands of dollars. So the medical insurance is exactly what that is. It's an insurance that will help you in times when you get hurt or get sick that you never planned for.
And are there penalties the students could end up facing if they don't have health insurance?
That is true, especially if they have a job and they file income tax. At the time of filing, the government will ask for proof that you have insurance. If you do not, then they're going to fine or penalize that person filing the income tax either 2.5% of their income or straight $679. They're going to pick whichever is the highest. The other negative side of not having insurance is just the fact that, like we mentioned before, if you get sick, you didn't plan for it, you get hurt, you didn't plan for it, now all that expense is out of your own pocket.
And it's the things you don't plan for that probably end up being the most expensive, too.
Totally.
If a student was interested in getting health insurance, but they're unable to get it through their parents or through their job, what are some first steps towards trying to find it?
If they're a student, my suggestion would always be look at the student insurance first. UNT negotiates with the insurance company to come up with a policy that's going to meet the needs of a student of that age. So where there are some things that the student insurance will cover, maybe another insurance policy would not cover. So I would strongly suggest always looking into the student insurance first, especially that we have the Student Health and Wellness Center that has full service. I mean, so you can get your labs, your x-rays, your treatments that can be done right here, and with the student insurance, pays 100% if the doctor orders any of those things.
So basically anything you could go do at a normal primary physician, you can get done here?
Yes. Now, if it is something that needs a specialist or even go to the hospital, then we have a referral nurse that will refer them out. But they will certainly attempt to take care of their needs right here first because the insurance pays so well.
What does a student need to do to be able to get on the student insurance?
Well, first of all, a student, like in the fall and the spring semesters, need to be enrolled in at least 6 credit hours. Then they are eligible to purchase a student insurance. The insurance policy is not sold from this campus. You go to a website. They do not require a health exam first. All they have to do is sign up, and then of course the insurance company will verify that they have enrolled in the number of hours that they need to be enrolled in. So it's very simple.
Okay, yeah, that sounds easy enough.
Mm-hmm.
If for some reason they would choose not to get insurance through UNT, do they have options through like the Affordable Care Act?
Well, they do have those options. I would strongly suggest before they purchase other insurance, it's not just about the monthly payment, it's about the whole plan. So yes, if they find something cheaper, it also may mean their out-of-pocket expense will be higher. So you just have to see what best fits your own lifestyle. But as for a student who does not have insurance, they obviously can still come to the health center. You don't have to have insurance to come there. Because they pay a medical service fee in their tuition, they don't pay an office visit, so they can come see a provider at no cost for the office visit. The only time there are charges is when they do have labs or treatments or x-rays that actually are using those services.
Okay, so if I went in with like a sore throat, it wouldn't cost me anything to talk to the doctor, but if they want to do like a strep test or a flu test, I would end up...
That's exactly right. Mm-hmm.
Are those pretty low-cost tests?
They are lower than what you would see at another provider. The fact that they're not paying an office visit keeps that cost down. And then so when they do a lab test in comparison to maybe going to an outside provider, it is much less than what they would charge.
All right, so for an uninsured student, it's usually definitely the better option.
Yes, it would be.
To be able to go here than anywhere else.
Yes, it would be.
And what about prescriptions? Are they able to get prescriptions and go fill them downstairs?
Yes, they can. Whether you have insurance or not, you can still use the pharmacy in this building, and they can always ask for a price quote before they fill it. And if they feel that they can get whatever the prescribed medicine at a cheaper cost somewhere else, then they can take their prescription outside to another pharmacy. But I think in more times than not, the cost here at the Student Health and Wellness Center pharmacy is much less.
Okay, so it's another way for students to save money by getting things done on campus. So if a student does have pretty decent health insurance, will they still save money by going here at UNT versus an outside doctor?
If they have insurance other than the student health insurance, then what they are responsible for the costs when they come through the clinic, if they have any. And then we give them a walkout statement, is what it's called, that has all the codes on it necessary for them to go ahead and file with their insurance on their own. Now, it won't pay it 100%, but they will get something back on those. As for the pharmacy, at this time, they do take a few other insurance. So all they would have to do is give them the BIN number that's on their card, and then pharmacy can tell them whether they take their insurance or not.
Okay, so if a student has outside insurance, they would be responsible for paying upfront, but then they could get reimbursed through their insurance?
For the clinical. Mm-hmm.
Okay.
And that's true with pharmacy as well. If they don't take their insurance, then they can always file it themselves with their own insurance.
Okay, and if they don't have insurance, do they have to pay in full on the day that they go for the office visit?
And that's a common question. We do expect payment on the date of service. However, sometimes there are additional labs or tests that are run that they were not expecting, and so it may run higher than what they expected to pay. In that situation, we do encourage them to call maybe a parent, and they will take payment by phone. As a last resort, we will do a charge account agreement. What they are agreeing to when they sign that is that they won't pay the balance by the end of the month, or a block is put on their account.
Okay.
Now, the block will affect registering for classes, graduation, getting copies of transcripts, and even financial aid.
Okay, so that might be kind of a scary thing for a student who is sick but doesn't have a lot of money and they don't know how much it will cost.
And of course, right. But what we really try to encourage these students to do is start taking responsibility and asking up front, how much is this test going to run? Okay. Do I really need this test to determine what's wrong with me? And they can always refuse if they choose to. Now, I would like to just say that a provider would not order the test if they felt like it wasn't necessary, but there are those options that they could always refuse the test if they're concerned about the cost of it.
Okay.
But there is that charge account agreement that they can agree to, so we certainly would not turn any student away if they need medical attention.
Yeah, and you would be able to give them maybe an extra week or two with the charge account in case it's just, they'll get the money, but just not today.
Absolutely.
So if a student is looking to get health insurance, whether it's here or otherwise or out in their life after college, what are main things that they should be looking for in an insurance policy?
Okay. I kind of touched on this a minute ago where I was saying that don't always go by the cost of the monthly payment, because the lower the monthly payment, obviously, is probably the coverage isn't going to be as good either. So you're going to want to look at what is the out-of-pocket maximum, or is there a maximum limit per injury or sickness? In some cases, if the payments are really low, it might be that they're only going to pay an X amount of the charges per injury or illness.
And if it's something like you broke your leg, you're in the hospital, you don't have the same authority to say, yes, I want my leg fixed.
Yes.
No, I don't.
Yes. So always knowing that when with medical insurance, other than when you're treated at the health center, you're always going to have some out-of-pocket expense, whether it's called a deductible or a copay, or just now you're over the limit. So you've got to look at the entire plan for an insurance policy and make a decision from there.
So from my understanding, the copay is like a charge that you have to pay, $15 or $25 every time you go for an office visit normally?
Other than the health center, yes.
Okay, so
I want to just keep that clear, that when they come to the health center, there is no copay. But if you do go to an outside provider or an outside facility, depending on your insurance, or if you don't have an insurance, but if you have an insurance policy, you are going to have a copay that's out of your own pocket.
Okay, and then with the deductible, is it usually you have to pay the first $100 of any injury? Is it the first $1,000 throughout the year? What is it?
And that depends on the insurance policy as well. With the student insurance, if you go to an in-network provider, it's a $500 deductible. If you take a real close look at your policy, there, from what I understand, are a lot of policies with a cheap monthly payment, their out-of-pocket or their deductible may be as high as $1,500 or even more.
Okay, so they might be saving money month to month, but as soon as they get sick, that's where they're going to have a big outlay of expenses.
Exactly.
There. And do you see a lot of plans with health savings accounts now too?
Well, since we don't really look at other insurance plans, I'm certainly not an expert in all the other insurances. Mm-hmm. But what we do see is what those health flex cards, where some of the plans will give them a medical credit card. Those we do take. And so, because they're run through just like a credit card.
Okay.
And so if a policy or an insurance company offers those, that is a good thing for these students if they have that.
Okay, because that can do another thing that'll help them pay for it now,
mm-hmm.
but still have a little bit more time and not have to come up with everything up front. So if a student is going out to get health insurance, what kind of documentation or qualifications do they normally need to get accepted on a plan?
And this would be other than the student insurance. And so many of them will require a health exam or a certificate of health where a doctor has signed off saying that there are no pre-existing conditions. Unfortunately, or fortunately, let's just say some of the plans don't look at previous conditions, which is a good thing. But all that has to be read prior to determining which insurance plan is going to be best for you.
So that would probably be another reason that students might want to think about getting health insurance now before they develop any pre-existing conditions.
Excellent point. Excellent point.
So what else might they need, or might they need to look at to get insurance? For
medical insurance, other than the student insurance, I think each one's going to be a little different. Like I said, I'm not an expert on all insurances, but they will be upfront about when you're looking into different insurance companies. They may even ask, like I think the government insurance plans even ask for income, and I think that helps them determine which plan to go into. But other than that, and having to show proof of health or good health, I don't know of any other things that they would need.
Those are the biggest things that they need to be aware of. It's easier if you're healthier.
Yes.
But for the student insurance, no matter what kind of pre-existing conditions you have, as long as you're an enrolled student, you'll be accepted.
That is exactly right.
Okay, so that's a definite advantage for any students out there who are worried about their ability to get insurance elsewhere. You can get it from here no matter what.
Absolutely. And I do want to say one more thing about that even. If you've had student insurance, and you graduate from UNT, they have alumni insurance that's offered.
Oh, really?
Once again, I'm not an expert in that area because we don't take care of it. But they do have UNT alumni insurance. Certainly have a website and a phone number if anyone is interested in that. So that would be another thing or they even have a continuation insurance that a student who has had the student insurance plan can continue it for another 30, 60, or 90 days.
Okay.
That would allow them time maybe to have a job, and then at that point the job will offer them insurance. So, but those would be two options to consider.
Okay, yeah, to bridge the gap if you're not able to get a full-time job right away. And you don't want to be insuranceless or end up paying really high out-of-pocket premiums.
Absolutely.
Do you know a normal range of what premiums would look like for student insurance?
I hate to be quoted on this because I'm not sure how long this is going to go. I don't know how long the podcast will be available for. And I did not bring all my pricing with me. Fall semester, which goes from August 14th through January 31st, is $997.
Okay.
And that's a one-time payment. But it will cover for that.
Okay, and this was as of fall 2017?
That will be going into 2018,
okay,
fall of 2018.
Gotcha.
I remember that amount.
All right, so that's what you'd be looking at for this upcoming year. If you're listening to this
fall.
in a few years ahead, it might have gone up. Or
In fact, I'm happy to even say that this is a little less than what it was last year.
Okay, so there's a chance it could go down too.
There's always that chance. So it's just something that's negotiated between UNT and the insurance company and what the coverage and so forth, but I'm real excited because it was a little over $1,000 last year for the fall semester.
Okay, so you've been able to. It looks a lot different a lot of the times in the eyes of students. Probably if you're seeing those 3 numbers versus 4 numbers.
Isn't that the truth?
Yeah, and it probably doesn't take that long. 1 or 2 injuries would get you over that $1,000 in a semester pretty quickly.
Absolutely. And, I will also mention that a lot of students will participate in the study abroad classes. And so going into different countries, we have a provider downstairs that's very knowledgeable about what each country needs for them to come into.
Okay.
It may require them to have certain immunizations. It may require them to take certain vaccinations. So if they have the student insurance, all that would be covered when they come in to the health center. And like I say, our provider would direct them as to what they need, and then they have their proof that they've taken care of that before they go into the study abroad across to some other country.
Okay. So if you have international students, does the student insurance apply to them too to be able to get care here?
International students, it is a requirement by UNT that they have student insurance.
Okay.
So it is already charged to them in their tuition. And if on occasion some of our students have a job and so they have other insurance that they get, like they work on for UNT, they do have the opportunity to waive the student insurance off of their tuition. And then they would still have their other insurance with proof of that. But for the most part, the majority of the international students, that charge is in their tuition.
Okay, so basically if you're an international student, there's a almost 100% chance that you can come in here and get the care that you need.
And they don't have to do a thing but just show up because it's already there.
Very convenient, very easy, especially I'm sure if you're in a foreign country and don't know how everything works.
And with the student insurance, the Student Health and Wellness Center is the primary provider. So they are encouraged to always come here first. Now, if they have a serious injury or broken bone, they're have a serious other health issues, such as maybe a heart issue, then of course go to the ER. Mm-hmm. But for the most part, this Student Health and Wellness Center can handle majority of the issues.
So when you have students and you're dealing with insurance companies, are there any problems that you see come up frequently between students and their insurance companies? I
think that can probably be better explained as the real problem is more understanding your policy.
Okay.
But every insurance company does have a 800 customer service number, and encourage once again for the student to take responsibility, make those phone calls when they don't understand, and ask them, why did something not get paid? Or how come it hasn't been paid yet? And at that point, they can certainly look in the system and see, maybe it just got delayed and the payment's still coming. But for the student health and wellness, for the student insurance, they have access to set up a profile with United Healthcare Student Resources. They can actually, by setting up a profile, see when claims are paid or if there's one pending, so they can manage their...
Okay, so it helps them kind of take control over some of this
Yes,
stuff.
and I think that's all part of being a student and learning about life, is that the medical insurance is just one more piece to that puzzle.
And if a student is trying to learn about this stuff and start figuring it out for themselves, is there anywhere they can go for help if they don't understand some
Absolutely.
of the policies?
For the student insurance, the website has the full policy out there. But once again, we'd encourage them to call the customer service number if it just doesn't make sense to them, so that they can talk through it. In some cases, I can even help them. However, I don't have access to their personal account, so I can only get them so far.
Okay, so you can help basically as far as what's explained to you or what's shown to you by the student.
Yes. And then as for other insurance companies, I do know, when I've looked at even my own insurance card, there are numbers that you can call and ask questions. And so they welcome that. That's just all part of the business, is just so that you understand what's going on with your own medical insurance.
Yeah, and that way you don't get caught in any of those. Surprise, you have a deductible, you have a copay, or this only goes...
I will tell you that it's surprising, but there are a lot of students that do not carry their insurance card with them, and they have one of those unexpected injuries, and they go to the ER, and they don't have their card, and there's no way anyone knows you have insurance unless you can present that card. So I just want to take this opportunity to encourage them to always carry their card, or find out how to get their card so that they can present it at those times.
Awesome. Do you have any other top tips or things that you want students to know about getting insurance?
About getting insurance is just, it's an expense, and we all have to do it. But I think while they're a student at this university, and even other universities, because there are some universities that offer the same type of student insurance, but to take advantage of that, because like I said at the beginning, we don't know what tomorrow has to bring. And unfortunately, we do get sick. And unfortunately, this past year, the flu symptoms went rampant, and even healthy people were getting very, very sick. So we just don't know. And even though it is an expense, it's an insurance that you will be taken care of if and when you do.
And we're the Student Money Management Center, so we like to look at, money and risk and things like that. It's a definite $997 expense versus a potential who knows how large expense if you don't have insurance.
I have seen where a student will go into a hospital and they'll bring me a bill and go, I can't pay this $15,000. It gets that high real quick. So it's a risk that you don't really want to play games with.
Yeah, but since you mentioned it, if a student does end up with a $15,000 bill from a hospital or something like that, are there things that they can work out with the hospital, or certain charges that they're able to dispute when they don't have insurance?
Well, first of all, when I see something like that and I don't see where insurance has paid on it, first thing is take your insurance card, go back and have them rebill it. Second of all, always talk to their financial department. Explain what you can and cannot do, because they will work with you.
Once again, that was Stephanie Wilson from the UNT Health and Wellness Center. Any additional questions, comments, or feedback about the show can be sent to money.management.unt.edu. The Student Money Management Center is your on-campus resource for all things personal finance. For additional information about us, you can go to moneymanagement.unt.edu or stop by our office in Chestnut Hall 313. If you liked today's show, please spread the word to your friends and fellow UNT students. Thank you all for listening, and I hope you have a wonderful week.